Bismillahir Rahmanir Rahim. I am Dr. Mumtazul Islam, and we are discussing reversible hydrocollides. Reversible hydrocollides, which are used in dentistry, are mainly for taking impression. So, what are hydrocollides? Hydrocollides, hydro mean water, and collides mean the solutions or the material which collides with each other, and hydro will be the medium where these collisions occurs. Actually, these are polysaccharide colloidal suspensions in water. We say them that these are solution, but actually these are not true solutions. These are not solution, not suspension. No any suspended particle can be seen, and not a true type of solution that you cannot differentiate. No solid particles present as in suspension, and not a solution. Solution is having a uniform consistency. These may have a shimmering type of or different grades of consistency can be seen. One area is somewhat thicker and other one is somewhat thinner, but they are in the form of a solution. Particles bear charges, that is why they collides with each other. Positive and negative charge, when comes together, they will attract each other, and when positive or negative charged particles come near to each other, they repel each other. So usually the attraction does not occurs in these solutions. Collision occurs due to the same charged particles. So already described as the medium is water in which these collides present, so it is called as hydro. Now the types, there are two types. Number one is sol and gel. Sol is not a true type of solution, and the other one is gel. Gel is another form which is not a suspension. Sol is of low viscosity in a fluid form and having random chain, or in other words you can say low viscosity fluid which having random chains is called as sol, while gel is anything which has a increased viscosity, and this in viscosity increases due to the plastic chains which are aligned. In sol we have random chains. Random mean haphazard. We can see that if we have this type of chains, these are random chains. Is it clear? And if we have aligned chain like this one, this one, this one, this one. So and they are branched with other chains through their ends. If we put them together like this, so these are aligned like this. So these are the random chains and these are the aligned chains. Sorry, they now these are aligned chains. They have no interaction in between. Now, fibrils. These are fibrils. These little fiber like or uh, small elements which makes this soul and gel particles, especially they make fibrils. Fibrils in the colloidal phase produces a jelly like condition. Either this form or this form, they always produce gel like consistency. This type of consistency will be more dense, more viscous, and this will be less viscous. More the fibril structure in gel, stronger jelly will form. If this type of structure is present, you can say a jelly will form. They are compact, they are more closer, and strength depends on concentration of polysaccharides. If more polysaccharides are present, then the strength will be more. And now I want to erase these things. Yes. Now the setting of these materials. Sorry. Yes. Last view, the previous one is the types, and now the setting. Yes. Setting occurs through conversion from sol to gel. Now, how gel formation commences? It commences in two ways. One is reversible and the other one is irreversible. Cooling produces alignment through van der Waal forces. You already aware of van der Waal forces, and through hydrogen bonding. Now, the reversible process, if occurs, then the produced hydrocollides are designated as reversible hydrocollides. And reversible hydrocollides are called as and known as agar. Agar. Agars are the polysaccharide which were extracted from seaweeds, and 15% of colloidal suspension of agar in water is designated as agar, which we are using in dentistry. High molecular weight and more free hydroxyl groups are present. Presentation is flexible tubes like tubes of toothpastes, syringes, not syringes with which we use for injection. They are syringes like these, but they have no needle. Now, borax, already we have studied about borax as a retarder. Again, it provides bulk retard. Provide bulk, sorry, it provide bulk and retards setting off gypsum model and dye material, which we already discussed previously. Then potassium sulfate, and this potassium sulfate activates, and retarding effect of borax will be eliminated through this. So these both are present in our reversible hydrocolloid or agar. Sometimes some people say it agar. Now the manipulation of agar, simple manipulation. If we see this picture, there are three compartments there. You can say a specialized water bath for conditioning. Again, heat treatment through water, if provided to any material, it is called as conditioning. Here we can see one compartment is of 100 degrees centigrade, the other one is of 65 degrees centigrade, and the third one is 45 degrees centigrade. Then, as we want to manipulate the agar or reversible hydrocolloid, we prepare it through conditioning by conditioning bath before use. Three compartments already described. Tube or syringe first immersed or kept in 100 degree centigrade bath. It will convert it into soul, because when we take a tube or syringe, it will have a temperature of 20-30 degrees centigrade, and it will be in the form of gel. So we have to convert it into sol by immersing the tube or the syringe into 100 degree centigrade bath. Then we take it and put it in to 65 degree centigrade till required by dentist or technician for mixing to take impression, and the mixing is done by squeezing, as it is only the tube, so there is no need of mixing. But as the material is converted into the gel form and is was present in gel form and converted into sol form, so a little bit of mixing by squeezing the uh, tube or syringe. We cannot squeeze the syringe, but to manipulate somewhat, if it allows to move the molecules in a way that uh, all the material have a same consistency. Then few minutes before impression, the tube will be transferred to 45 degree centigrade bath. Why? That now we are going to take the impression of the mouth. 65 degree centigrade temperature is not as much high that it can burn, but some patients may be sensitive, enough for that temperature, so it will be reduced to 45 degrees centigrade by immersion in that 45 degrees centigrade bath. And the impression is taken by conventional method. We will discuss it, already discussed, but we will discuss it again and again. Now, application. Different consistencies are available in market, but nowadays it is also obsolete type of material. You cannot find any agar impression material in your market. Crown and bridge work impressions were advocated for were advocated for taking impression through agar. High viscosity sole loaded into tray. This arrow mean that poured or loaded into tray, and low strained over prepared tooth or teeth. While low viscosity is strained over the prepared tooth or teeth, like we have done in copper ring technique. What we have done that we in but in copper ring technique we have put it the impression material, that is impression compound, into the copper tube, and then that tube was applied over the prepared tooth. But in this case, low viscosity material strained over prepared tooth or teeth. Teeth were prepared or tooth prepared, and syringe was taken, or syringe filled with that agar material, and then it was applied over that tooth. And the impression tray, if present, and if we are using single technique, then the other material, the other consistency, which will be more thicker, more viscous, loaded into the tray, and then the tray was applied over the teeth or tooth, tooth, for which we are going to take the impression. Temperature hysteresis effect. Hysteresis present at sole to gel transition and vice versa. Transition from sole to gel is slow at mouth temperature. It is obvious when we are going to cool down any material from 47 degrees centigrade to 37 degrees centigrade, it will cool a difference of about 10 degrees centigrade. It will be cooled down slowly. So to accelerate it, we use cold water spray or water cooled trays. Water cooled trays, that the trays you have seen having inbuilt system of tubings through which cold water passes, and it cools down the agar material, the impression material, agar. Material near material near the water tubes sets rapidly. Near the tooth, obviously, it sets rapidly because water is going to cooling down the material. Near tooth, it can flow and record even the tray moved slightly. It is the advantage of agar material, that near tooth It can flow and record. Even you have moved, you have given slight movement to the uh, tray. And removal is through snatching action, abrupt with a jerky pull like this one. Now, syneresis and imbibition. Syneresis, in simple terms, you can say the squeezing or expulsion of water on surface. You can take the example of perspiration on your forehead during summer. It is syneresis. Water comes out through your body. So that same process, if present in agar or in any other material, we can say it that it is syneresis when water comes on the surface of the object of any material. Now imbibition, simple mean water uptake, swelling of material through water uptake. If a material takes water, obviously it will swell up. Agar is very much susceptible for both. Then impression should be rinsed and kept covered in a damp gauze, because if condition is damp, so there will be a balance. No entry of water into the material and no exit of water from the material. Model must be poured within 30 minutes. And again, not possible to make metal coated or epoxy resin dyes. So this will be discussed in other chapter, that why we have to make metal coating or epoxy resin dyes when we uh, study dyes and models, etc., especially gypsum products and other materials. Now, the clinical advantage of agar, its water absorption capacity is its clinical advantage. Why? That impression of a provisional ill-fitting crown is very much difficult. A crown in a patient's mouth which is ill-fitting. Ill-fitting means loose, not fitted properly. Due to that gingival inflammation and increased clavicular flow. Gingival inflammation, that the gingiva over that area, when an ill-fitting crown is present, gingiva will be inflamed, swollen up, and increased clavicular flow. Clavicular liquid from the gingiva flows there in a rapid and more frequency than any other area. So there will be an increased clavicular flow. So what we have to do, we have to take two impressions, because impression of a provisional ill-fitting crown is difficult through any other material due to these two things. So it will be possible with agar material, that first impression we have to take two impressions. First impression takes up moisture because it has the capacity to imbibe. And second one would be accurate, no gingival inflammation and no increased clavicular flow. So we have to take an accurate, we are able to take an accurate impression. It can be reused because it is thermal set. Its setting is not through any chemical, it is thermoset. It is, its setting is temperature depending. When we raise the temperature, it will go into sol form. When we lower the temperature, it again attains the gel form. But cross infection due to the reuse is a limitation as with other materials. So we are not using it as a reusable impression material. Now, types and applications. As previously I have explained, type 1 is a high consistency and used for complete and partial dentures. Alone or in combination with type 2 or type 3, where type 1 with high consistency previously described that we have to syringe. So what we have to syringe type 2 or type 3, and type 1 high consistency will be inside our impression tray. So it is type 1 high consistency agar. Then type 2 medium consistency, it is multi-purpose, itself used in extruded technique, combination technique. Now this extruded technique or combination technique is that type 2 impression agar material loaded into the tray, and the type 2 material also loaded into the syringe, and then it was syringed over the prepared tooth or teeth or area from where we want to take the impression. Then the type 3 is low consistency, it is multi-purpose, and it only syringe with type 2 or type 3 type. So type 3 is of very much low consistency and it can be used only with syringe. Type 3 also can be used as tray material but not in use. So only syringe with type 2 or type 3 with type 1. Sorry. There is a missing. Here we can write and type 1. Sorry, I make it more type 1. Is it clear? Yes. Type 3 with type 2 and type 3 with type 1. Only we can use type 1 material in tray form, but type 2 and type 2 can be used in type tray form and type and with the syringe, and type 3 only syringe. Type 1 has highest consistency, type 2 has medium consistency, and type 3 has lower consistency. Now, the properties. Fluid in sole form used for recording fine details as we have described in impression plaster. Now, it is again a mucostatic. Why? Because of its low viscosity. Now, reproducibility. According to ISO 1564 specification, it must copy 0.02 millimeter line in a metallic block. It must copy that much of fine line. If present in a metallic block, then it will be sufficient for taking impression and its reproducibility is authentic. Compatibility with gypsum products, that it can produce 0.05 millimeter line upon production of a cast. When we pour plaster of Paris or gypsum product into it, a line of 0.05 millimeter will be produced if gypsum product cannot produce a 0.05 millimeter line, then its compatibility with gypsum product is questionable. Flexible for undercut cylinders, sorry, flexible for undercuts. Undercut, already we have explained that anything which impedes insertion or removal, or which restricts, or which uh, is difficult to withdraw from withdraw or insert any object. Flexible for undercuts, a cylinder of 20 millimeter long and 12.5 millimeter diameter will be made, and a measuring load of 125 gram and then 1.25 kilogram was applied over that cylinder, and minor strain of 4% and major strain of 15% must be recorded. If more than this, it is not of our use. If less, then it will be good. Viscoelastic recovery can be optimized. Viscoelastic recovery, for understanding the viscoelastic recovery, you can simply imagine the shock absorber of your motorbike, of your car, or any other thing which have a shock absorber. That whenever you press that, it goes downward or it goes to the lower level, and then after that, when the load is removed from that shock, it will slowly and gradually recovers. This is the viscoelastic recovery, and it can be optimized through four parameters. Number one, amount of permanent deformation, presence of undercut or and the severity of undercut, and the stress time. Permanent deformation occurs when we goes through an undercut. If time taken for removal of that uh, material from that undercut, which will be severe, it will be there will be more permanent deformation. And if it will have less time, less severe and undercut, so there will be less deformation. If stress time reduced, elastic recovery enhanced. Same as I have described, that if undercut, even it is severe, but you snap snatch it the material over that undercut in a less time after its setting, not before its setting. So if stress time is reduced, then elastic recovery will be enhanced, because now the time will be less for its stressed state, so it will comes out more rapidly. So quick snatch recovery is also advised. That is why we advise that quickly remove the impression tray after you realize that the material is set. For that, the cylindrical specimen of 20 millimeter high and 12.5 millimeter diameter were for compressed for 4 millimeter. If recovery after 1 second load application is 96%, then it will be a appropriate material for taking impression. And which material? Agar. Mechanically, it is poor. It's obvious that mechanically it is a sol or a gel cannot provide you a mechanically sound um, property. So it is a mechanically poor object which we have taken from the patient's mouth. So care should be taken that this impression which we have taken with agar is mechanically poor. Tear strength is low. Tear strength. Tear mean to torn apart. So if you have to stretch it, it will be torn apart easily. So its tear strength is low. That is why interproximal and subgingival areas are very difficult to record, because first it is mechanically poor, and the second, interproximal and subgingival areas. Interproximal mean the area between two teeth, interproximal, and subgingival area in between the tooth and gingiva. These are very difficult to record through agar impression material due to its mechanically poor properties and low tear strength, because there the sections are very much thin, so on removal they can easily be broken down. Tear resistance, TS, tear strength of materials, that of different types of agar material are, for type 1 material it is 0.75 Newton per millimeter, and for type 2 and type 3 materials it is 0.5 newtons per millimeter. Then often small drops of water are visible on surface, like perspiration. So what this phenomena is? Syneresis. So high water content is responsible for evaporation of this water content, and ultimately this causes shrinkage. On the other hand, imbibition produces swelling. Dimensionally, again it is unstable, not stable, because due to the uptaking of water or outgoing of water or evaporation of water content. Not always possible nor advised to make more than one cast. So it is always advised to make only one cast. Why? Because the gypsum product have some water, and on its setting it can also draw the water from the agar material. So not more than one cast is advisable. Now duplicating material, yes, it is an used as a material which is called as duplicating material, and here during duplication it can be reused because of its low cost. How duplicating material, we can duplicate any model through this. How? Duplicating cast or model on a glass slab surrounded by duplicating flask. I am just making a sort of uh, you can say drawing. This is a glass slab and this is our dentures, you can say. So cast or model, this model placed on a glass slab, and it is surrounded by a duplicating flask. This will be a duplicating flask. So this is a duplicating flask. This end is open. This end, yes, this will be open for pouring of agar, melted or conditioned uh, agar material into this. Yes, duplicating material is heated at 50 degrees centigrade. When it comes to in a sol form, then poured into the flask through this hole. Temperature kept as low as possible. The surrounded temperature will be kept as low as possible. You can use another thing if present there for keeping this uh, cold through application or through pouring cold water or any other thing. Now contraction prevented also by cooling the flask from base. So try to prevent contraction through cooling the flask from base. If we uh, cool this flask from here, from there, then from this, then gradually, and we uh, cool down it up to this level, then this will be our gradually we use. If first we cool the flask at this level, then we cool at this level, then at this level, and then again at this level, the flask will be cooled down, and it is the cooling starts from the base of the flask. This is the base and this is the upper end of the flask. or you can say head of the flask. Uh, Now cast remove immediately after setting and poured. So if this happens, that this all the material here sets around this cast, when we put this flask, this this material can be retrieved, this denture or model, and then we invert this flask, place it another in at another point, and then we pour the material after the setting of this agar. Retarding effect avoided by treating the surface by accelerator. So if retarding effect is there, so it can be treated by it can be corrected by or avoided by treating the surface through accelerator. Now, no, 1 minute. Now, thank you. And this is the duplication or duplicating. And thank you. A big thank you for your patience. So kindly go through this lecture, open up your book, and then we will meet after a while, inshallah, and we will do the practicals as well. Thank you very much.